Okay, I can see it. Welcome back, Dr. Finnoff in the studio from Barton Health. I can't say enough about you, Dr. Finnoff. I mean, there's a few heroes in my life, and I have to tell you, you're one of them. And now you bring in this ultrasound machine where actually he's diagnosing me. I'm only 33. Yeah. Good Lord, you're making me sound like I'm falling apart here. But a new technology that you're kind of doing a lot with lately, right?
Yeah, absolutely. You know, ultrasound has been used therapeutically for heat, but it's used diagnostically for a lot of different things. And what people commonly think of as babies. You know, they look at babies, but we're using it a lot in
We didn't see any babies in there, did we?
I looked. You don't have a single baby in your elbow.
Whew, although my mom's going to be disappointed. She's hoping for a baby.
Grandkids.
But you're using them a lot in the therapeutic world.
Yeah, so we use it in orthopedics. It can be used to diagnose abnormalities in tendons and ligaments, and look at muscles, all sorts of different things. And we can use it to guide interventions, such as injecting growth factor types of medicines, essentially, into joints and into tendons. We can do releases, such as a carpal tunnel release using ultrasound.
Really?
So a lot of different things that you can use ultrasound for. Guiding joint injections. So if you have arthritis in your shoulder, or rotator cuff problems, or arthritis in your knees, you can use ultrasound to guide the needle into the specific place and put the medication in, and it does a great job.
So it's more localized. So because everything was cut and burn for so long. Surgery is the answer, surgery is the answer. And I love to see this technology because it's a little less invasive.
Yeah, absolutely, absolutely.
So you're going to take a look at my elbow.
Yeah.
Now, I'm not left-handed, so this should be, should be really perfect in there.
So I'm going to show you a few different things just to give you an idea of what ultrasound can see.
Still no babies, right?
So no babies.
Okay.
Right here is the radial nerve.
Okay, yeah.
Between a couple of muscles there, and over the top of a cartilage cap on top of bone.
That's a good-looking muscle right there.
That's a good-looking muscle.
That's strong.
And as we go down, you can see the nerve dividing into two, which is normal. And this one part of the nerve coming down inside of the muscle down in here, right there. So, I mean, you can follow even very, very small nerves all the way down and through this area.
Wow, and it's very high resolution. You can actually see what's...
Yeah, absolutely. And another thing that we can do is look up here at tennis elbow. I'm going to have you bend your elbow just a little bit right
It's kind of scary that I'm a good case for tennis elbow. I've never played tennis a day in my life. This is...
Don't start now.
What happened?
So right here is the bony contour from the edge of your elbow.
Okay.
And here, this gray here is the tendon arising off of it, and this is what normal tendon should look like.
Okay.
As we scan back and forth across your elbow.
Probably the only normal part of my body right there. Jeez.
Yeah, it's a little bit dark down in this area here compared to if you see here, this is nice and gray. Right there, it's kind of dark. And that suggests that you're having a little bit of fluid accumulation in that area and maybe some wear and tear. From your lack of tennis playing.
From my lack of tennis playing. Could be skiing. And then you would actually go in with an injection if it got bad enough and localize that particular area,
Absolutely.
correct?
You could guide a needle right down through the skin, through the muscle, right down into this area right here that's abnormal, and inject various substances, various medications into that area to try to help trigger a healing response.
And what would you can use this on anything, any joint, any particular tissue, correctly?
Yeah, it's best for superficial located things, so close to the surface. It's not as good for things deep inside. It actually has higher resolution than MRI for structures that are close to the surface, but it can't see through bone.
Okay.
So it's not great at looking inside of a joint. It's good at looking at the surface and around a joint. So it could look at your Achilles tendon in your ankle, or the ligaments that get sprained in the ankle. It can look at your tendons up in your hamstrings and in the muscles in that area. But it's not going to look inside your hip joint.
Right.
So very good for certain things, and other modalities are better for other stuff.
Well, it's good to see. I mean, it's good to see a technology out there that's so localized and so specific. And I'll tell you what, it's fascinating, especially in the carpal tunnel world, because it seems like that's very common. Yeah,
carpal tunnel is the most common entrapment of a nerve in your body, and it's right here in the wrist. There's a tunnel right there. And if the nerve gets pinched, it causes all sorts of different problems in your hand. And you can see where the nerve is getting pinched and guide a needle right down into that area. And where the ligament crosses this spot and pinches the nerve, you can put a needle through that area and loosen that ligament so that it gives you more room, and the nerve can pass through that area. And it only takes a few days to recover from that, whereas a surgery, it takes much longer.
Right.
Now, this isn't the end-all, cure-all for all things. A lot of people still may need surgery for carpal tunnel syndrome, But a carpal tunnel release with ultrasound is a very, very viable option. It's really easy. It doesn't take long to recover from. You know, people can be back to work in a couple of days. So, pretty amazing.
You're making it easy for us, Dr. Finnoff.
You
come and we'll all have to go back to work like the next day. Oh,
No.
you're good. Go back to work, you know.
I know.
Well, we're going to scan my head next, and we're going to figure out if there's anything up here. You see anything in there?
It looks kind of dark.
Oh, great. Dr. Finnoff, Barton Health, thanks for coming in. How do people get a hold of you?
They can call Tahoe Orthopedics and Sports Medicine. And also, I'm giving a talk on this as part of the Community Wellness Lecture Series. It'll be at Lake Tahoe Community College, and that's Wednesday night at 6 p.m. in the Aspen Room at Lake Tahoe Community College.
You're right. It is pretty dark up there. This is not a good thing.
I think I saw a moth.
Oh, gosh. We'll take a short break. We'll be back. I want to thank Dr. Finnoff for coming in from Barton Health. Make sure you show up to his lecture series. It's a good time. Back with more Tahoe Today right after this.